Daniel Ferreira was 52 years old and had never missed a weekend barbecue in his life. It wasn't an exaggeration, it was a tradition. Every Saturday for as long as he could remember, first at his father's house in Houston, then in his own backyard in Sugar Land, Texas, with his children, with the neighbors, with the smoke rising through the hot Texas afternoon as he stood in front of the grill in the black apron his wife had given him as a Father's Day gift in 2009. He knew the right temperature for each cut. He knew when to flip it. He knew when the charcoal was just right. It was the thing he did best and with the most pleasure all week. In March 2023, Daniel went to the gastroenterologist for a routine colonoscopy, the first of his life, scheduled because he had turned 50 and the doctor had said it was time. He had postponed it for 2 years. He had rescheduled 3 times. He had finally gone, because his wife had said she wouldn't accept any more excuses. The procedure lasted 48 minutes. The gastroenterologist came out into the waiting room with an expression that Daniel's wife, Marcia, recognized as different even before he opened his mouth. There was a mass in the sigmoid colon, solid, with visual characteristics that the gastroenterologist had photographed and biopsied. The biopsy results came back in 4 days. Adenocarcinoma, stage 2, presence of moderately differentiating cells, margins to adjacent tissue still favorable. Daniel had been silent for a while that Marcia later described as very long. Then he had asked something. Why me? And here is the answer that science has to that question, an answer that Daniel never fully received, because no doctor had had the conversation that should have been had 15 years earlier, when the risk was still preventable. Grilled meat does not cause cancer. This sentence needs to come before the next one, because what comes after depends on a distinction that most people have never received, and that separates real risk from unjustified panic. The meat itself is not the antagonist. The antagonist is what happens to the meat when the temperature exceeds 150 degrees Celsius in direct contact with a flame or hot surface. When muscle proteins and creatine react with intense heat, they produce compounds called heterocyclic amines, HCAs. When the fat from the meat drips onto the charcoal or flame and the combustion gases return to the surface of the meat, they deposit compounds called polycyclic aromatic hydrocarbons, PAH. HCAs and PAH are genotoxic compounds. They enter colon cells, bind to DNA, and produce DNA adducts, molecular lesions that, if not properly repaired by the cellular repair system, become mutations. And accumulated mutations, over years, in specific genes that control cell division, KRAS, APC, TP53, build colorectal adenocarcinoma. Not in one meal. Not in 1 month. In 15 years of weekly exposure, cumulative dose session by session, grill by grill, Saturday by Saturday. And here's the microhook that makes this personal before you fully understand the mechanism. HCA formation doesn't depend on the type of meat. It depends on temperature and time. High-temperature grilled chicken produces more HCAs than moderately grilled beef. The doneness of the meat matters. The charred part matters. The smoke matters. And what happens in the intestines after decades of exposure to these compounds is a process that begins long before the first symptom, and that could be detected long before the diagnosis Marcia heard in the waiting room. But the detailed mechanism, and why Daniel specifically, comes after a piece of data you need to hear first. 153,000. That's the number of Americans who will be diagnosed with colorectal cancer this year. It's the second deadliest cancer in the United States, behind only lung cancer. And the fact that most people don't know. The incidence in adults under 50 years old increased by 51% between 1994 and 2019, according to data published in the Journal of the National Cancer Institute in 2020. It's not a disease of the elderly. It's a disease that's growing precisely in the age group that still thinks they have time before needing a colonoscopy. But before we get to the mechanism, and the mechanism will change the way you look at the barbecue this weekend, we need to go back to Daniel. Because what was happening in his colon over the last 15 years, level by level, cell by cell, is a story that medicine can tell with precision. And telling it with precision is the only way to understand why he never felt anything until the mass was already there. In 2018, Daniel went to his general practitioner with lower back pain. The doctor ordered tests. Everything was normal. In the medical record, in the lifestyle section, the doctor had written, diet, no restrictions reported. Exercise, moderate. Alcohol, social. Smoking, never. There was no field for meat preparation methods. There was no question about the frequency of consumption of grilled meat at high temperatures. There was no calculation of cumulative exposure to HCAs and PAHs over decades. There was a medical record that said Daniel was healthy, because by the criteria of what was asked, he was. But in Daniel's sigmoid colon in that same year of 2018, there was a polyp. Small, less than 1 centimeter, completely asymptomatic, completely removable in a 20-minute procedure, completely invisible without colonoscopy, and completely present, waiting for the next 5 years of Saturday barbecues to complete the progression from adenomatous polyp to adenocarcinoma. There were 2 options in 2018. The first was what happened. General practitioner treating lower back pain, negative tests, patient back home, grilling continuing every Saturday. The second was a protocol that the American Cancer Society had updated in 2018 to recommend starting screening with colonoscopy at age 45, in which Daniel, at 47 years old, and with a history of high consumption of processed and high-temperature grilled meat, could have been referred to undergo. Daniel was 47 years old in 2018. He had a removable polyp in 2018. He had a 5-year intervention window that closed in 2023 with a diagnosis of stage 2 adenocarcinoma. No one had asked about the grill. But now you will understand exactly what 15 years of grilling were doing inside Daniel's colon while he was in a black apron in front of the grill on a Saturday afternoon in Texas. When the surface temperature of the meat exceeds 150 degrees Celsius, which happens on any grill over charcoal or open flame, 2 simultaneous reactions occur. The first, amino acids and creatine present in muscle proteins undergo a Maillard reaction at high temperatures, producing heterocyclic amines. The most studied HCAs are phipphidazes, objecti usia groutuaminosyc, 1-milithise, and T-N-barminas, the 6-phidazes, cophise amyloxec hierophise 100 to 15 and perdita bichur. Thibazout wistam. The second, the fat in the meat drips and produces incomplete combustion, generating polycyclic aromatic hydrocarbons, especially benzopyrene, which rise with the smoke and are deposited on the surface of the meat. The amount of HCAs produced is proportional to the temperature, cooking time, and degree of surface charring. A serving of chicken breast grilled at high temperature for 12 minutes can contain between 14 and 38 nanograms of FIP per gram of meat. A serving of well-done beef on the grill can contain between 2 and 18 nanograms per gram. It seems like a small amount. In a weekly meal over 15 years, the accumulated dose becomes biologically relevant. When Daniel ingested these compounds, they reached the colon, where bacteria from the gut microbiome and enzymes from liver metabolism converted them into reactive forms, especially N-hydroxy-FIP capable of covalently binding to the DNA of colonic epithelial cells, forming DNA adducts. The cell's DNA repair system attempts to correct these adducts. In most cases, it succeeds. But with repeated chronic exposure, the rate of adducts exceeds the repair capacity. Some adducts persist, and persistent adducts and critical genes produce mutations. In 2015, Rashmi Sinha and colleagues at the National Cancer Institute published a prospective analysis of 300,948 participants in the NIH AARP diet and health study in cancer research. The data showed that participants in the highest quintile of consumption of high-temperature grilled meats had a 47% higher risk of colorectal adenoma, the direct precursor to adenocarcinoma, compared to participants in the lowest quintile. The risk was dose-dependent. It increased proportionally to consumption, and it was specific to high-temperature cooked meat, not to meat in general. 47% for the consumers with the highest exposure. Daniel had been in that group for 15 years. But the data that Sinha did not publish in 2015, just because it was not possible to publish it at that time, is what would happen if these participants had been screened with colonoscopy before the age of 50. How much of that statistic would be removable adenoma before becoming adenocarcinoma? Because Daniel's polyp existed years before the diagnosis, it was removable. The window was open. It remained open as long as no one asked about the barbecue grill. But the mechanism of HCA formation is only half of what Daniel needs to understand about what happened in his own body. The other half is more disturbing, because it involves not what he ate, but what he drank along with it. Studies conducted by researchers at the University of Utah, published in the International Journal of Cancer in 2006 and replicated in subsequent analyses, documented that alcohol consumption, even in moderate amounts, even within the limits considered socially acceptable, synergistically enhances the genotoxicity of HCAs in colorectal tissue. Alcohol induces cytochrome P450 enzymes, especially CYP1A2 and CYP1B1, which are the same enzymes responsible for the metabolic activation of HCAs in their carcinogenic forms. In the presence of alcohol, the activation of HCAs is faster, more complete, and produces a higher concentration of reactive forms in colorectal tissue. Daniel drank beer at the barbecue on Saturdays. There was always some, 2 or 3 glasses, enough to silently enhance what the grilled meat delivered to his colon every week. Beer didn't cause Daniel's cancer. HCA alone didn't cause it. Alcohol alone didn't cause it. It was the combination, the barbecue and the beer, together every week, for 15 years, that built up the cumulative dose the polyp needed to complete its progression. And nobody had asked about that, because the medical record field said alcohol, social, and stop there. Because there was no integrated risk calculation between exposure to HCAs and alcohol consumption. Because that calculation doesn't exist in any colorectal cancer risk screening questionnaire used in American primary care. The instinct to gather the family, to maintain tradition, to offer the best meat cooked to perfection at the right temperature. The instinct that had given Daniel his identity in a black apron every Saturday afternoon for 15 years, was not what caused his cancer. The tradition wasn't wrong. Grilled meat isn't poison. The grill isn't a weapon. What was wrong was the temperature, and what was missing was the information that temperature matters biologically, that the black mark on the meat isn't just aesthetic, it's genotoxic. That marinating meat before grilling reduces the formation of HCAs by up to 99%, according to data published in the Journal of Food Science in 2008. That turning the meat frequently, every 2 minutes instead of one long turn, reduces the formation of HCAs by up to 75% by keeping the surface temperature lower. That pre-cooking in the oven or microwave for part of the time and finishing on the grill quickly reduces the exposure time to high temperatures and consequently the formation of genotoxic compounds. Simple interventions, without abandoning tradition, without abandoning the grill, without sacrificing the identity that Daniel built over 15 years of Saturdays. What no one had said is why no American primary care protocol includes guidance on meat cooking methods as part of a colorectal cancer prevention conversation. What American medicine learned from Daniel Ferreira, from NCI's data at the NCI, from Utah's analyses of alcohol and HCAs, and from the 153,000 colorectal cancer diagnoses that occur annually in the United States is that there is a documented, measurable, and interruptible causal chain between high-temperature meat cooking methods and colorectal adenocarcinoma, and that this chain is completely absent from the prevention conversations that doctors and patients have in routine consultations. What Daniel never received was the conversation from 2018, when he was 47 years old, when there was a removable polyp in his sigmoid colon, when the window was open, when a 20-minute colonoscopy would have found something that a 48-minute procedure found 5 years later, with a stage difference that will determine the next 2 years of his life: surgery, adjuvant chemotherapy, semi-annual follow-up, the permanent suspension of a part of his Saturday identity that he still doesn't know how to replace. Daniel underwent surgery in May 2023, removal of the affected colonic segment with clean margins, adjuvant chemotherapy with Folfox for 6 months, oncological follow-up every 3 months, favorable prognosis for stage 2 with favorable features. He went back to grilling in October 2023 with Marinade, with a thermometer, turning every 2 minutes, without the charred part, with children who still didn't fully understand why their father had changed the way he did what he had always done the same way. The black apron is still there. The grill continued, the conversation never came. The difference between a grill that produces Saturdays that build memories and a grill that accumulates enough genotoxic doses to build colorectal adenocarcinoma over 15 years is not the type of meat, it's not the frequency of consumption, and it's not genetics. These are 3 interventions that anyone can do now without giving up tradition, without consulting a specialist, and without spending more. First, marinate the meat before grilling. Any marinade with acid, lemon, vinegar, wine mainsugar reduces the formation of HCAs by up to 99% according to a 2008 study in the Journal of Food Science. The marinade creates a barrier between the meat proteins and the intense heat that prevents the genotoxic Maillard reaction. It doesn't need to be long. 30 minutes is enough for a significant reduction. Second, flip the meat frequently. Flipping every 2 minutes instead of leaving one side long, and flipping once keeps the surface temperature of the meat lower and reduces the formation of HCAs by up to 75%. Surface temperature is what matters, not the total cooking time. Third, and more important than any change to the grill, if you are 45 or older and have never had a colonoscopy, the American Cancer Society has recommended screening since 2018. If you have a history of high consumption of processed or high-temperature grilled meats, a family history of colorectal cancer or adenomatous polyps, screening should have started at 40 or earlier. Daniel's polyp existed before the diagnosis. It was removable. The difference between finding a polyp and finding an adenocarcinoma is literally the procedure you scheduled or didn't schedule the week the doctor said it was time. Daniel rescheduled 3 times. Marcia didn't accept the 4th rescheduling. Don't expect someone else not to accept yours. But high-temperature grilled meats aren't the only regularly consumed American food whose preparation method produces genotoxic compounds without any doctor's office conversation mentioning the mechanism. In the next video, the oil you use for high-temperature frying and the volatile aldehydes that form when polyunsaturated vegetable oils are heated above their smoke point, which are deposited in the lung tissue of people who cook indoors and which the World Health Organization classified as probably carcinogenic to humans in 2021. The oil that seems healthy may be the problem. The method that seems correct may be the risk.